Welcome to today's lecture. I'm Dr. Wu-Lung. I'm endocrinologist. I will show you and share you about the knowledge and the clinical practice experience about diabetic foods. We often describe some food symptoms are caused by diabetic food, but what kinds of food we can call it as diabetic food? Diabetic food is defined as a structure or functional alternation of the food, such as ulceration, infection, and or gangrene associated interaction of different factors induced by maintained hyperglycemia and previous traumatic cause, although the food did not have present lesions. And please notice the key words: neuropathy, peripheral vascular disease, and infection. If a patient has neuropathy, he may lose sensation so that he would have trauma or wounds at the foot easily. Hyperglycemia may develop severity even without having a trauma or injury. Peripheral vascular disease may lead to chronic pain or ulceration symptoms. When you meet a refractory wound, don't forget to evaluate the vascular disease. Diabetic food have symptoms. The symptoms usually they prevent wounds or pain. In clinical practice, patients won't come and say, "Hey, doctor, I have diabetic foot." In reality, patients may report pain or wound symptoms. This lecture will focus on wounds or ulceration symptoms. Patients with diabetic foot ulcers or history have an increased risk of 5 to 10 years mortality. But it is not proven yet that healing diabetic foot ulcers improve longevity. Let's talk about cause of diabetic foot symptoms. When patients develop diabetic foot symptoms, if we know the cause of reasons, we will know how to prevent it. There's a great journal paper published by American Diabetes Association in 2018. In this figure, it shows that sensory neuropathy, motor neuropathy, and autonomic neuropathy and peripheral artery disease will put the foot at risk and even lead to foot ulcers. Besides glucose control, our diabetes educator will check patient status during regular clinical visits. We will check whether if the patients have inflammation or infection signs. Let's talk about pathophysiology of diabetic wounds. When we got injury or have a wound, the N1 macrophages and interleukin-6, interleukin-12, TNF-alpha, or some factors will increase, and they will lead to inflammation. And then, in the later time, the N2 macrophage will increase, and this phase will promote healing. The factors like interleukin-10, interleukin-4 will increase. But if a diabetic patient has diabetic wounds, the phase will delay. The N2 macrophage will delay. So the wound healing also delay. There's a hypothesis about why diabetic wounds heal delays. In the medication, Some papers found insulin may help diabetes when heal, but why? And maybe insulin will promote some factors and promote N2 macrophage and maybe increase the healing or wound recovery. And what are risks of diabetic foot symptoms? And as you see, their tables tell us about which patient have urgent risk and high risk or low risk and very low risk. And if we meet a very urgent risk patient, maybe you have to refer to the medical center or specialist as soon as possible. But if a very low risk patient or symptom, maybe you can follow up regularly. In routine clinical visit, you may check the pulse of dorsalis pedis and posterior tibial artery, and whether if the patient loss of sensation about foot protection. The more the patient lows, the higher risk the patient has. And how to evaluate diabetic foot symptoms? There's some categories like wound, ischemia, infection. If the wound have gangrene, it's more higher risk. And if more ischemia symptom, higher risk. If the infection sign more systemic, it's higher risk. Maybe sometimes you don't have a instrument to measure the ischemia, but instead you can make a physical examination to touch the patient's foot to check whether the temperature of the foot is low or high. And as briefly described in the session, you want to improve the care. You have know how to treat the wound, how to treat the ischemia, how to treat the infection. As we see at previous slide, if more wound condition, more ischemia symptom, more infection symptom, the risk is especially high. But if the wound condition is okay, the ischemia symptom is not good, it's still high risk because some patient may develop gangrene if the wound is still small. So you have to evaluate 3 items: wounds, and vascular, and infection. Let's talk about the treatment of refractory ulcers. Typically, standard care is provided for 4-week periods because the wound they don't reduce in size by more than 50%, but after 4 weeks, refer to other medical center or specialist is often indicated. Standard care includes ensuring good vascular supply, preventing and treating soft tissue and bone infection, performing excisional debridement, maintain debridement or crucial important problems, and make sure the patient adhere to your medical advice and sometimes even high quality offloading. Numerous therapies can be applied for those ulcers. However, not many of them have high evidence to show it really help healing ulcers. But we still can use this material, wound dressing material, to treat the patients. Here are the abbreviations, and I show you the abbreviation here. like PRP, DSS, or HBOT. And I know maybe you don't have so many treatment in your office, in your hospital, but in my experience, if you can follow my experience, maybe you don't need to use negative pressure wound therapy. You don't need to use hyperbaric oxygen therapy. You just need to treat by regular or simple wound dressing material. It also can help wound healing, but you have to follow my lecture. I will show you how to treat them more quickly, or let the patient heal more quickly. And in my experience, many referred cases don't heal more than 4 weeks or even 6 months. If you perform deployment and good food care for the patient, but the wound didn't heal or improve much, please re-evaluate the foot ulcer or wound again. In refractory ulcer or wounds, I often see patients are mistreated. For example, if the wound is caused by venous disease, you should try to aid compression therapy rather than repeat surgical debridement again and again. And as you can see in the photo, the left one is venous ulcer related symptom. You don't just change antibiotics again and again. You may just aid the compression therapy. Don't forget it. But beware about ischemia symptoms. So sometimes I would like to exclude the artery problem. If no artery problem, maybe I will think it's a venous situation lead to ulcers and add compression therapy. And there are many bandage for venous ulcer. In my experience, even simple methods like the photo C, it still works. You don't need very expensive bandage. If you have, okay, but if you just have simple one or easy one, it's also helpful for the wound ulcer healing. Do you ever teach the patient to exercise and how to exercise? There are many articles or research discuss about the exercise for diabetic foot ulcers. I will recommend the burgers exercise if you want to accelerate the wound healing and teach how to do exercise. And in this research, we see the comparison before and after exercise training, the concentration of oxygenated hemoglobin increase. So the figure tells us really after exercise training, the circulation, the oxygenation situation improve after exercise. As you see, the bar increase. Let me show you some cases. A diabetic patient has wounds at right lower leg, but the wound didn't have any improvement after 6 months treatment at another medical center. Then the patient come to me and I just take a thermal image of the leg. As you see, the blue color shows cold temperature. This one it's very cold. It's not very hot wound. So the circulation maybe not so good. And you can easily see there's poor circulation around the wound. It is unfortunate that no one tells or teach him how to do daily exercise for wound healing. And then, yes, the wound later healed. Why? We teach him to do the full exercise for wound healing. Then after a few weeks after, his wound healed. No expensive drug, no expensive surgical treatment. We just prescribe the exercise plan for him. So remember, exercise as medicine. And I'll show you another case. A diabetic patient have wounds at right lower leg for more than 4 years. 4 years. Whoa, very long time. And in the treatment history, the patient received wound debridement, hyperbaric oxygen therapy, and even 3 times perivascular intervention at his right leg. But the wound didn't heal. And the patient was referred to my clinic. As you see, the wound is at the ankle. But in the physical examination, I feel the circulation around the wound is good. I don't think repeat vascular intervention will help him. I think repeat perivascular intervention won't help wound healing in this case. So I don't recommend repeat perivascular intervention. But what happened? I checked the nutrition status of this patient, and I found that although the patient has good glucose control, but he has zinc deficiency. It's a minor nutrition, and zinc deficiency will delay wound healing. After zinc supplement and our standard wound cares, his wound healed. So don't you forget the wound nutrition evaluation. You must evaluate the wound nutrition. In previous case, I present you the wound's nutrition evaluation is very important. Malnutrition status may delay wound healing. In daily clinical practice, there's a bias in medical staff and patients. When I told obese patients they have some nutrition deficiency, they usually responded me surprising fast. It means that they don't believe it. How can they have a nutrition deficiency? And obesity may accompany by micronutrient deficiency causing low micronutrient levels. And however, body mass index and weight loss may not identify this. So remember, an obese patient didn't mean he have adequate nutrition. Let's talk about nutrition. You may see the journal for the wound's nutrition. It's a nutrition for all kinds of wound, not only diabetic wound. And in this paper, you can see how to eat well. In eat well, we need some carbohydrate like potato or bread, and we still need some proteins and some foods and sufficient hydration is also necessary for the wound. If you see the wound is very dry, you better check whether the hydration is enough or not. You may tell the patient to hydrate or drink water more. And then, but in diabetes, we have another issue. The fruits have much vitamin C, but if you eat too much fruit, the glucose level will increase and even beyond our control or even under medication. But if without vitamin C, the wound heal may delay. So it is important to evaluate what patient eats rather than only control glucose level. In many cases of my clinical patients, some of them have very glucose control, but they don't eat fruits. So maybe they have very low vitamin C level, and low vitamin C level may delay the wound healing. So how to balance the food intake and glucose control is important. So sometimes if you eat too much fruits in order to increase the vitamin C will lead to glucose control become worse. In this situation, maybe I will prescribe some vitamin C tabs or supplement to the patient, because if you want to learn to eat adequate vitamin C from fruits may lead the glucose control worse. So to balance this, maybe sometimes in order to heal the wound quickly, maybe I will use some nutrition supplements rather than from natural source. Just use the business items and vitamin supplement or to treat the nutrition deficiency. In summary, we talk about cause of diabetic foot symptoms and later treatment and exercise for diabetic foot wound and ulcers, and nutrition evaluation as support. And don't forget to find the causes, and don't forget exercise as medicine. And the most important people don't notice is the nutrition status. If you meet a refractory wounds, just remember to reevaluate the wounds, whether if it's venous related and whether you don't teach the patient how to do exercise and whether if the nutrition is adequate, not just to see the glucose level. Please check the nutrition status like albumin status, zinc status, vitamin C status, and in all of these, if you perform well, I think many patients will heal more quickly. Thank you for your attendance. Thank you.